listen for the lady. All right, recording in progress. So for those of you who have been to other Zooms in the previous months, you've heard me hint that I'm a massive geek. And this is the one that I'm most excited about talking about, this topic, because, you know, we all talk about that, the sentence, knowledge is power. I think that the NDIS is the most beautiful example of that, because myself and my co-host Alex, who will meet in a sec, have seen so many NDIS planning meetings where if a participant has not been informed, they absolutely have a very different experience and outcome. And so we are huge advocates of anyone who wants to and anyone who's interested, get informed with all of this stuff we're about to talk about, because we have seen it really empower people where they get to speak NDIS. So first off, hello from Darragland in Sydney in New South Wales. And I would love to acknowledge the traditional owners of this land and elders past, present and emerging, and would love to welcome you all here from wherever you are in the country. So I'm not sure if we have any guys from Queensland or Victoria or South Australia where we have other hubs, but welcome to you all. You may have met me before. I am the NDIS support manager at Fighting Chance until about 2:45 p.m. tomorrow afternoon, because tomorrow is my last day at Fighting Chance. But I'm definitely not leaving the sector. So I've been there for 6 years now and been in the sector for a good old 16 years. And now more than ever, compared to any other time that I've been in the sector, this is the time where people need to understand how to speak NDIS, because it can really change the outcomes in people's funding. So I'm really excited to talk about this with you tonight, but particularly excited to talk about it with my friend and colleague, Alexandra Brown, who is just as geeky as me. And over to you. Who are you, Alex?
Hi, I'm Alex, and I work at Fighting Chance as well. I've been in the sector for about 10 years, and I've been a friend of Lisa's for quite a while now, and we share the same geeky knowledge and passion around the NDIS and supporting people in the community to access the supports to help them to build their capacity to meet their goals. I work at Fighting Chance as a senior support coordinator and psychosocial recovery coach. I also work in the Access and NDIS support team with Lisa, and tomorrow it will just be me moving forward. My background is occupational therapy, so I have some clinical understanding and knowledge there as well.
All right, so Alex and I are going to share the slides tonight. We are going to be going back and forth because we can't help ourselves, because we're so excited about these topics. But both of us are very friendly, approachable presenters. So please, if you have questions, either pop it in the chat and we'll watch that and make sure we come to them. Otherwise, you can pop yourself off mute. We just want to really support you guys to understand this stuff tonight. So we're really heading down the road of three main resources and tools. We're going to tackle a particular section of the NDIS legislation. Then we're going to meet the cousin of the legislation, the NDIS rules. And then we're going to tackle one of the most important, in my opinion, operational guidelines of the NDIS, which really tackles funding responsibility. So when the NDIS says to you in a planning meeting, oh, the NDIS doesn't fund that, that's mental health's responsibility, or that's education's responsibility. We're going to show you the resource that can help you to actually objectively feel like you can speak on that. So we'll go through those three things. So let me just check the chat. Love a good OT, says Rando. Awesome. I love the banter in the chat. Thank you, Rando. So over to you, Alex. What even is the difference between the NDIA and the NDIS?
So I'm sure that you guys have heard lots of people kind of go between NDIA, NDIS, and it might be like, why are they switching between? So the NDIA essentially is when we're talking about the agency. so the people that manages the scheme, which is the NDIS. So NDIA stands for National Disability Insurance Agency, and NDIS stands for National Disability Insurance Scheme, and that's the money. And so the NDIA, there's a board that is approved by the minister, and they essentially are helping to ensure the direction and ensure that it's implemented correctly, which essentially is being like, we know that there's lots and lots of changes that happen at the NDIA often. So these things are being reviewed quite frequently, which is why these changes, and we have to keep an eye on the changes because they happen so much, especially during COVID. There was always like a joke of how many times it changed within COVID. So they do try and do their best to kind of keep up to date with those things and try and improve them as much as possible.
And in really good news recently, the sector's been celebrating that finally we have some representation of people with lived experience of disability on the board of the NDIA. So that's some recent wins.
Yeah. And essentially, so we're going to be talking about the NDIS Act today, and the Act is the legislation. So you might hear it be called the Act, or you might hear it be called the legislation, but it's essentially what frames the scheme and defines the scope. So we're going to be talking about planners and LACs in a minute, but it's essentially what they need to be basing their decisions on. So they need to use the information that's in the Act to make their decisions when it comes to funding. And so obviously the CEO cannot make all the decisions because that would be a lot of work. So there's delegates that have that authority, and the delegates can be called delegates, or they might be called planners. So you will hear that's probably words that you've heard before, that the planner will approve the funding. So they need to use the NDIS legislation to ensure that the decision that they are making around the funding is in line with the legislation or in line with the Act.
So the CEO can't make the decision around funding for 530,000 Australians.
No.
So then they delegate that power to different people in the agency, and mostly you're going to see that through a planner. So what even is a planner?
So so some people might say, oh, I've got a planner, or oh, I've got an LAC that I'm speaking to about my plan. So there is a bit of a difference between the two. So an LAC, or a local area coordinator, as you probably are aware now, the NDIS has the NDIA has many acronyms. So LAC stands for Local Area Coordinator, and they are employed by a partner in the community. So the NDIA, or the agency, put out a tender, and this organization has won the tender to represent the agency, and they are then the partner in the community, so in your area, and then they've employed LACs, or local area coordinators, to help with the planning meetings, or the whether it's a first planning meeting, or whether it's a plan reassessment meeting or a plan variation meeting. They can they support that. So they are not part of they're not employed by the NDIA, and they do not make the funding decision. So their job, and they're not a delegate, so their job is to essentially gather the information from you and write it all down, gather all the reports and the supporting evidence, type it all up into their system, and they build what they feel is an appropriate plan, and then that gets sent to the planner for approval. But some people have a planner straight away, and it just depends on whether you are whether you've been identified as being sort of more, I guess, simple plan to more advanced plan. And so if it's more complex, then you go straight to a planner. And if it's less complex, then you're usually sitting with the LAC. Sometimes they get that decision wrong as well. So you can transfer to a planner, but a planner is employed by the NDIA and is a delegate of the CEO. So they could be called delegates or they could be called planners. It's the same thing. And they do make the funding decision. So if you have a meeting straight with the planner, then they will put it all into the system, and then they will make the funding decision. So essentially the LAC is a step before the planner and sort of is giving the message to the planner, and the planner is making that final decision. But the if you're straight with the planner, then there's no middle person, and they make that final decision.
Rando, thank you for your song. Why'd you have to go and make things so complicated? I agree. Bronwyn is asking, in early childhood, there also could be a planner or LAC. Yeah, because there
That's
are also
right.
others, yeah.
Yeah, so under 7, they could be called early intervention facilitators or early intervention coordinators, or early childhood coordinators. So there's a few different names, but essentially they are a partner in the community as well. So it and it's sort of it's more just for you to understand, I guess, where the person sits and who you're speaking to. So when you call the NDIA, so when you call the 1-800 number, you're not speaking with an LAC or a planner. So you're speaking with essentially someone from their call center. So just it's good to be aware of that as well, that it's not actually an LAC or a planner that you're speaking to.
With a question from Diane,
Mm-hmm.
their planner left the NDIA in June and they've not been able to get the details of a new planner despite numerous phone calls. How long can you be without a planner or delegate for?
So they will, unfortunately, they will probably not reallocate you to someone else or that you know of until the plan is coming up for reassessment, unfortunately, and then it gets allocated to somebody, so it can sort of sit in the NDIS land for a while without. And it's only when it's starting to come up for reassessment that they will reallocate, or if there needs to be a you've lodged a review. That is, I would say that if it's been longer than 14 days, which it sounds like it has been, then calling the NDIA, the 1-800 number is the only really way to speak to someone to escalate it. So the call center person will put an interaction into the system, which will escalate it to the planners. Yeah, that's ridiculous. Sorry, that's like, that's not, it's not. So what you could do is you could call the partner in the community, which if you're in Sydney, then it would be Uniting. But you can even call, in my experience, it can take months to get any response from the NDIA, whatever the reason for call or query. Yeah, it can take months, but if it's an urgent, if it's a review request, or if it's a like an urgent inquiry, then they really should be giving you an answer within the 14 days. And so if you're not getting that, if it's housing, it's longer. And if it's AT, it can be longer. But if it is just for a plan reassessment or plan variation that you've lodged, then it should be within 14 days that you get some sort of correspondence back from them with a response. And that usually is in the form of a letter. And the letter will state that it will state whether they've approved it or they haven't. And if they have approved it, then someone will be in contact to book in a meeting.
We need to crack on though to the other stuff, because they've already had their Zoom about plan reassessments and variations. So we best crack on so we can get out at 8, because there, in case you're wondering what Alex is talking about around reassessments and variations, go back to the Fighting Chance recordings of previous Zooms, and you'll be able to check in on that topic, because there were a lot of changes around that. Because we did promise we'd get super geeky with you guys around the legislation. So,
and that's what Lisa's going to start to talk about now for a bit.
So Alex has just introduced you to the role of the delegate in decision making around funding. And so they need to have a framework around how do they decide what funding they will and will not approve in plans. And so the thing that we know is that I'm not a delegate, Alex is not a delegate, you're not delegates. So we actually don't have the right to determine whether something meets this legislative criteria, because we're not delegates. However, we can use the language of the decision makers to help try and spoon feed them on a platter the decision-making language. So we're about to have a look now at the legislation. So apologies if anyone in the room is a lawyer, because I'm not, and I will not explain it, you know, probably as lovely as if there was a lawyer in the room. But here we go. So the NDIS Act of 2013 has many sections in it. You know, some are based on eligibility for the scheme, lots of different sections, but section 34 is where we learn about reasonable and necessary supports. And this is the 6 criteria from which funding decisions are made. Now, the thing to say here is that whenever you are trying to justify funding in your plan, or you're having people write reports or supporting letters trying to justify and recommend funding in your plan, all 6 of these criteria need to be addressed for the planner to feel satisfied to then hopefully approve the funding. So all 6 of these criteria. Go, Alex.
Lisa, yeah, for every recommendation, it's clear, it needs to be for every recommendation. So if there is a recommendation for supported independent living, or a recommendation for an employment program, there needs to be a clear justification around each of the reasonable and necessary, each of the criteria needs to be addressed in both of those recommendations, not just like one blanket one.
So let's go through each one, and then Alex and I can throw in examples of how we've seen this work. So the first one is that anything that's funded, so the support will assist the participant to pursue the goals, objectives, and aspirations included in the participant's statement of goals and aspirations. Classic NDIS, overwording it. Basically what they're saying is, what we fund needs to be in line with the person's disability-related NDIS goals, which is why it's so important to be prepared for your funding reassessment meetings before you get there, having spent the time to write these goals, because we know that funding decisions will be referring back to the goals. So there won't be something funded unless it can be linked back to the person's NDIS disability-related goals. Okay, so the message there is, turn up to your funding meetings, your planning meetings with your goals prepared, carefully thought through, so that you can make sure you address part A.
And it needs to be, so that's why when we talk about like if you have been in a meeting, sometimes the LAC or planner will guide you towards it as well. But if you have a support coordinator, they may also say this. And this is why we say that having the goals quite broad is really good, because it means that more supports can be linked to it. But we also need it to be sort of, we need it to be specific in a way, like we need it to be working towards something, whether it's independence or employment, but we don't want it to be so specific where it closes in the ability. So it might say, we don't want it to say, so-and-so would like to work towards supported independent living with the support of their support workers, because that's limiting the goal to just being linked to the support worker funding. We want to keep it broad, but we want to also have it's like in a direction of a achieving a certain goal around a certain area like independence or employment.
So I can see lots of action in the chat, but I'm just going to not look at it until we get through the 6 criteria, and then we'll jump to the chat because I'm sure there's some really important questions and comments. So let me just get through the 6 criteria first. So the next one is the support will assist the participant to undertake activities so as to facilitate the participant's social and economic participation. I want to give you an example of how I've seen this happen. Now, what I also want to do is give you all permission to feel comfortable with this language and start to talk about it with your report writers and your therapists, because sometimes you might be working with an amazing therapist who's an amazing therapist at what they do. Their clinical skills are outrageously fantastic, but maybe they don't know how to speak NDIS, right? So you might actually need to help them. So I'll give you an example. I was working with someone who had a specialist neurological physiotherapist, so highly skilled, highly trained clinician, and they wrote a physio report for someone's plan reassessment. And in the report, they were writing things about the test results of the person's assessments. So the outcome of their 6-minute walk test or the sit to stand result, and all of these clinical scores. And being an ex-physio, I said to the physio, thank you for the report, but you're a physio who's writing a report for an NDIA planner who highly likely is not a physio. So we can't speak physio, we need to speak NDIS. So I then had to say to them, what do these results mean? What does this mean around this NDIS participant's life? And they said, well, because of these results, what it clinically means is that this person is at a higher risk of falling. I was like, okay, so there's clinical significance around their risk of falls. And I'm like, why does that matter? I was trying to draw out the NDIS language, and they said, well, it's because their goal is to, you know, feel more confident and independent in their mobility, including outdoor mobility. I was like, okay, we're getting somewhere. Why does that matter? Because the person's been socially isolated because of their falls risk and they want to be more part of their community. I'm like, now we're getting there. Now we're starting to talk about how the physiotherapy assessments and recommendations is around facilitating that person's social participation. But if all they did was leave those clinical results around times and you know, clinical outcomes, it didn't connect to what their funding recommendation meant in regards to that person's social participation. So you might need to help draw that out. The next example I want to give is around the third one, around the support must represent value for money, in that the cost of the supports are reasonable relative to both the benefits achieved and the cost of alternative support. And I want to give an example here around a really good friend of mine who's an NDIS participant. So he requires transfer assistance in and out of bed every evening. And in his old accommodation setting, he would be transferred into bed and a support worker would sometimes transfer him into bed, but my friend was still reading his book or he was still watching TV. So if that support worker left my friend's home and forgot to turn all the lights off or left the remote control too far from my friend's reach, my friend had to then call back a support worker, one-on-one support at an evening rate, just to turn off the lights and hand him the remote control. Not value for money. When my friend moved into his new home and living setting, he was able to justify that getting his lights, doors and electronics automated through assistive technology and using his phone and iPad to turn these things on and off, they were able to justify that that upfront cost was an investment that was value for money, because over time it would mean that he does not now need support workers to do that for him ever again. So that's one way he was able to justify value for money, just as one example. The next one is the support will be or is likely to be effective and beneficial for the participant, having regard to current good practice. So we're going to have a look at a bit more detail around this one in a sec, but really this one is saying that for something to be funded, it needs to be shown to be effective and beneficial, most likely through an evidence base. So this is where we ask the therapist to provide evidence around what they're recommending. So an example of this is I was working with a participant who had a personal trainer, and the personal trainer couldn't yet speak NDIS. So they were recommending all of this intervention. And I said to them, is there a clinical paper that you could provide that's backing up what you're recommending, some evidence-based research? And they said, oh, absolutely. And so then I'm like, great, we need to link it and reference it in your supporting letter, because that is then showing what is current good practice. So according to the NDIS, current good practice is that there is an evidence base based on research and expert opinion in the field, something that the NDIS has learned through the fact that the NDIS has been around now for 10 years.
Or
it could also be
personal
linked,
experience.
it could also be linked to the experience of the participant. So what has been effective and beneficial for the participant as an individual. And so that actually could be evidence that the participant presents as like a participant statement, or they may have been collecting evidence over the plan period around, you know, the positive impact of a certain intervention on their life, on their function, on their quality of life. So that also exists as something that could be presented as evidence. The fifth one is saying that the funding or provision of the support takes account of what is reasonable to expect of families, carers, informal supports, and the community. Basically, this one here is a tricky one, because this can be subjective. So this is really saying, should the NDIS fund this, or should the person's informal network of support do it? And so a lot of the time, the conversation for Section 34, Section 1, Part E, is around parental responsibility. And so this changes over time. So for example, if there's an NDIS participant who is 7 years old or 8 years old and they require supervision and prompting with their personal care, then the NDIS might say, well, we're not going to fund that because that's parental responsibility, because many 7 and 8 year olds need prompting with personal care. However, if a parent is providing the intimate personal care of a 35-year-old NDIS participant, that parent would be well within their rights to state that it is no longer reasonable to expect that of them because of the different life stage of their adult child NDIS participant. So for this one, it really comes down to any of you who might be here tonight who is a carer or an informal support, and really giving yourself permission to think about, well, what is reasonable to expect of me, dependent on the life stage of the person that I'm supporting. So as the person you're supporting ages or goes through different life stages or transitions, your answer to what is reasonable to expect of you might change, and that's okay. And be prepared to self-advocate and state what is and is not reasonable to expect of you.
Some an example that of a document that you can provide, it can be a hard document to write, but it can be quite powerful, is putting together a document where it has a table of things that a neurotypical person that same age is doing, and then the things that the participant is doing, and that comparison can be very powerful. It can be really hard to write. I do really empathize with that, but in terms of the NDIA and what they are looking for, what that is essentially showing is it's really pointing out this point of what you're doing as a carer, and that it's related to the disability, but it is it's not appropriate because someone at the same age is doing that task independently, and so that can be a powerful document to write to really highlight this point. It can also be that you will get pulled up, and this makes me really angry, just not the parent side, but also if someone has a partner and then they say, oh, but the partner can do it. No, it's not appropriate for the partner to do intimate personal care and different tasks that a carer would do. That's not appropriate as a support, as a partner, and it can really create an imbalance in that person's relationship and really jeopardize the relationship. So advocating that it's not appropriate is very much within your right, and feeling empowered to do so is really, I guess, our goal for showing you this document. But yeah, it can be
Well, there might be some things that you are willing to do and some that you're not. And I guess if you're wanting
it's
to,
your choice as well.
Yeah.
Like you shouldn't feel like, and sometimes it's cultural and sometimes it's you feel like you have to do it because you love that person, which is really nice. But just know that there are supports that can take a bit of that off your shoulders so that you're able to still be mum or still be dad or still be, a partner to that individual. So there you do have you can have that space to be able to ask for support.
And then the sixth point is basically saying, is it the NDIS's responsibility to fund this support, or is it another government mainstream bucket of money? So this is the document I'm going to reference to in a minute, which will help answer section 34(1) part F. Now, what I want to say about using this legislation in your reports and in your communication, don't be afraid to reference it like you're someone doing a high school or a uni assignment. So actually referencing NDIS Act 2013, section 34(1) in brackets A, B, C, D, E, or F. And I guess using this information to empower you to speak the language of the decision makers. So for example, if you are wanting to write a carer statement or a carer impact statement, you could say, and referring to the NDIS Act of 2013, section 34(1) part E, it is no longer reasonable to expect me to do A, B, and C. So you can use this language to empower you. Now, I want to flick to the NDIS rules. So can you now see the NDIS rules? I've just changed documents. Alex, can you see now part 3 on the screen?
Yeah.
Okay. So these are all linked on the slide, so you don't have to worry, but basically the NDIS rules is the cousin of the NDIS legislation. So what this gives you is some more language and some more wording around some of these criteria relating to reasonable and necessary supports. So I just wanted to highlight to you that a lot of the people that may be in your support team may not know about the rules. Many people know about section 34. They may not know how to speak it, so you can help them with that. But many people then don't realize that the NDIS rules also exist, and these also can be really carefully used to justify funding requests as well, because they're actually giving you language that you can reference and use in your report writing and in your requests. So for example, they've given you some language here around the value for money criteria, and they also have language around the effective and beneficial criteria, and again around the one relating to what is reasonable to expect of informal supports. So as an example, you might say, when considering Alex's request for funding for a certain service, we have assessed whether there are comparable supports which would achieve the same outcome at a substantially lower cost, and we have found that. You can use the language in this document within the evidence that you're presenting. And again, Alex and I went through, how does the NDIS determine whether something is effective and beneficial and current good practice? Here are the 3 ways that they might determine whether something meets that criteria. So they're actually giving you the answer. And again, they're going through, how do we decide whether something is reasonable to expect if a participant is a child or if a participant is not a child? So they're actually gifting you some language here that you can then use back speaking to them around the supports you're requesting. I'm just going to stop sharing that.
And the more you do that, the more you speak back to them and use their language, it's sort of giving them the answer as well to put forward to the delegate or to put forward to the planner to strengthen your request for the funding that you're asking for. So you want all of this to link back to the funding that you're asking for. And so using the language that they are that they need to adhere to means that that will strengthen your request, and you have a higher chance. We can't guarantee it because, like Lisa said before, we are not delegates, but this is what they need to adhere to. So if we adhere to it as well and play their game, then we have a higher chance of getting the support funded. But it also gives you the having this understanding of these different things. So just what Lisa's sharing at the moment, a bit more summarized. So if you're thinking about a support, and then you think about these 6 points, does it pursue the goal? And does it facilitate social and economic participation? Is it value for money? Is it effective and beneficial? Does it take into account what is reasonable to expect from informal supports? And is it appropriately funded by the NDIS? So is it disability specific? Then you can, if you can kind of tick that off in your head and you know that the supporting evidence is talking to each of those points with their request, then you know that that request is sort of strong. If it doesn't, then you know that, okay, maybe that is not something that the NDIA funds, and maybe it is funded by a mainstream or a community support instead. So it will help you to kind of filter out the things that that NDIA can and cannot fund. So it can save you a bit of time as well, and a bit of effort, knowing these points that they have to tick off, and they have to have clear evidence to back up when they are building in a support into a person's plan.
And I just want to say, when you feel a bit more familiar with the language in the legislation, if someone at an assessment says to you, oh, that's not going to meet reasonable and necessary criteria, you can say to them, oh, okay, that's interesting. Which criteria will it not meet? And actually feel empowered to say, I know that there are 6 criteria. Which one are you referring to? And you'll probably shock the assessor because they're probably going to assume that you don't hang out with legislation on Tuesday nights. But you can say to them, so which criteria do you think it's not going to meet? And also, if you're speaking with a local area coordinator, remember they are not allowed to determine whether something is reasonable or necessary. So if they're telling you, oh, that's not going to meet the reasonable and necessary criteria, you go, oh, well, you know, I've gathered the evidence, I've presented it. You know, if you could obviously please pass that on, because I know that the planner is making that final decision. So here's some summary points as
Lisa,
well, Alex. Yeah.
Lisa, I'll just I know there's a lot in the chat, so we'll go through that soon, but there's I just want to reference just one of the comments. I've briefly read it, in the last comment in the chat, just to make a clear point that yes, we know that NDIA don't always read the reports, which is really disappointing. But something that I will do is, which we shouldn't have to do, but it is something that I will do, is put a document that's attached with clear each reasonable and necessary point and what section of the report links to it, to the support that's being asked for. So if it's housing or if it's employment, and then linking it back. It's a lot of effort and it shouldn't have to be done. But if you can even have a mental note of that, and when you're speaking in the meeting that you say, can you please look at this part? It references reasonable and necessary here. So it is a lot of work, but it can be really powerful. Even just you referencing it and you knowing, and them knowing that you know the language and you know the legislation and section 34 will give them confidence in knowing that the reports and the requests are more appropriate, and they're more likely to kind of go back to it. But it is their role to read it. So if you're finding that they are not reading and you're getting a plan back that is not appropriate, and you have clearly seen that they haven't read the reports, you can request another meeting and them to redo it. So you can always do that if you are unhappy and unsatisfied, and obviously you can review the plan. But if you feel like they haven't read the reports and they haven't read the evidence, you can ask for another planner and another meeting. So
All
just going back to the reasonable and necessary, so only the NDIA delegate can decide. So if it's an LAC doing the meeting, then they need to communicate to the delegate everything that you've said in the meeting. So the more that you have written down, the more that you have there, that you know they're getting the exact language that they want to hear, the better. So all 6 criteria must be met in each of the reports for each of the requests. And it must be shown at every NDIS planning meeting. So whether it's a first planning meeting, reassessment, internal review, and external review, all requests must link back to reasonable and necessary. And even though we are not delegates, if we can learn to speak the language of the decision makers, then it will help us to advocate for our people, and empower each other to be able to get the plans that our people deserve.
So I'm just going to flick through and just show you guys that there are some images here to remind you to look at the NDIS rules when you get the link. So we've had a look at the rules. I've put some images here around some of the language we looked at for some of the parts of the NDIS rules, but I also just want to give an example of how a carer impact statement might have a paragraph that references the NDIS rules. So for example, it might say, at the age of 27, Jimmy now resists me as the provider of his intimate personal care. Despite Jimmy very clearly requiring one-to-one assistance for all intimate personal care, please refer to the attached OT assessment for further evidence on that. It is no longer reasonable to expect this to be provided by me. If there is an ongoing expectation that Jimmy's intimate personal care continues to be provided by me, it will be an expectation that is not age appropriate, will place a risk on the long-term well-being of myself and the sustainability of my role in Jimmy's life, and reduce Jimmy's potential for capacity building as he works towards increased acceptance of formal support in his goal of supported independent living. So this is referencing language in legislation in the NDIS rules, and it is a carer who is saying that something is no longer reasonable to expect out of them. And I actually could have done better here. I could have referenced in brackets the NDIS rules, and I should have done that to make it even more obvious. And I just, before we get to questions, wanted to show that the NDIS rules also has a section which tells you what they won't fund. So that can also be helpful. We will not duplicate other supports. We will not fund something if it's not related to the person's disability and if it's going to cause harm or risk. So these documents, although we joke that they're geeky, they can actually be a real gift to us. So I'm now just going to head into the chat and see where we are at, because we have a lot of stuff to look at. Okay, we had some people who couldn't see the screen. That's okay now. Okay, so Rando is saying, do their policy or guidelines indicate an expected time frame and escalation processes? Yes, so there is such a thing. Alex, are you able to Google the participant service guarantee and put a link in the chat?
There's also a link in there for someone shared a link for the supports across a lifetime. That's also a really good link. What did you want me to Google again? Sorry.
The NDIS participant service guarantee. So Rando, there are some guidelines that the NDIA is trying to guarantee to participants about how quickly they'll do certain things. And my recommendation is, if they do things outside their promised time frames, that's grounds for a complaint, and you can reference the participant service guarantee to do that. Okay, I'm just aware of the time and I don't want you guys to have your dinner late, so I'm just getting through. Sorry, Bronwyn, I said funding meeting rather than a planning meeting, because sometimes that's how it feels. Yep. Ruth is saying, any new goals and requests for funding must be submitted to the planner 6 weeks before the plan reassessment meeting. Only in theory, Ruth. Many a time I'm emailing someone's goal to the planner or LAC live in the meeting. So it's okay. That's definitely best practice, but they still should be able to accept it even after the planning meating. As long
they
as
can definitely accept it even at the planning meeting. They can accept it. So yeah, it's definitely not, if it's within 6 weeks, it's not like it's not counted. So yeah, like Lisa said, it's best practice, but it's not always possible.
I love your example, Beth, of a narrow goal is I would like to play basketball with a local basketball team. Yep, too narrow. And you then said you could broaden that to be talking about participating in sport with a local team. I'd even take it broader and say I would like the supports to be able to feel part of my community and socialize with peers and build my relationships and confidence in my community, like even make it bigger. So I'm just having a look at the comments. Parental responsibility was mentioned by Bronwyn. Yep. So that's definitely some language we hear from some LACs and planners, which can sometimes feel quite subjective and judgmental. So be prepared with what you think and what you want to say is reasonable from your perspective. Okay, I'm having a look. Rando is expressing frustration. Yep. But Rando, the more you're informed with this language, hopefully the more empowered you'll be, because you are the CEO of your NDIS plan. Rando thinks the cousin is easier to understand. Yep, the NDIS rules definitely has more language. So I agree. I think it's a useful document, but it doesn't cover all 6 criteria. So still have the section 34 and its cousin hanging out together. Okay. Bronwyn, thank you for the link. I love that reference document as well. Okay, getting there. Okay, so Ruth, you're talking about a review of a reviewable decision when you mentioned the acronym ROAD. That language actually died on June 30. They now call it the request for an internal review of a decision. But yes, that's what I think Alex was saying, that if a plan comes back where it looks like they really haven't looked at your evidence.
Yeah, but you can even request not a review of the internal decision, like an internal review of the decision, even before that point, if you've had a planning meeting and whatever type of planning meeting or a funding meeting, however you want to call it, then, and you feel like at the end of the meeting that it's gone really badly and they haven't looked at your reports, you can ask for another one. Exactly. So that's wiped and you get a whole new one.
Rando, don't worry. I can see the hands, Rando. You're very good helper though. Thank you. So Tegan is saying, is there a way we can contact you, Lisa or Alex, for support on topics? So Fighting Chance does have an NDIS support program. However, there is a waiting list, but possibly can you pop the email address in the chat?
Yeah,
Alex?
I'll put the email address in the chat. Definitely email this email address, and if it's it will be sort of me answering the questions but I'm happy to do so. If it is ongoing support, we do have a wait list, but if it's just questions here and there, happy to answer them. And so,
all right, we have 2 hands up, then we have another section to crack on in 10 minutes. So Julia, your hand was on first. Go, Julia. Are you there? Okay, maybe you're having something to eat. So Carmel, go Carmel Hillier.
Hi, thank you. First of all, Lisa and Alex, thank you. This is just brilliant information. I really do appreciate your time in putting it all together, because I know it's not a quick thing to put together.
And I don't know. Like talking about this. So it's our happiness. Don't worry, Carmel.
Thank you. I don't know if this is too specific, but listening, if I've got a request for the NDIA where I can actually tick all of those 6 boxes in regard to the language that you've mentioned, that we would adhere to every single point. I would really appreciate additional funding for my son for transport, but they will only give me a certain amount. For example, with taxis, they stipulate that I must use support workers. They are a little bit like hen's teeth sometimes, particularly if the job's only 2 hours. Am I able to dispute them on that?
So there are criteria around the eligibility for the different transport levels. Have you seen that, Carmel?
Yes.
Yeah.
I know, I appreciate that there are limitations, but I was just wondering if it's possible to contest that, because it's more cost effective to us to use the taxi than it is to hire support workers for, 2 or 3 hours.
So I
but I
have heard of outcomes of people having a level of general transport funding that's higher than level 1, 2, or 3, but I've heard that it only really happens if you go all the way to the Administrative Appeals Tribunal. But you're right.
The alternative though is you can get additional funding put into into the core budget and into social, community and civic participation part of core, although cores are flexible, and that can fund transport. Now there are taxi services, like there's one called Web Cabs, and they can use that funding out of core, so you can have that additional cost funded, so that is an option as well, but it tends to be, if it's going to be the contribution, then it tends to be that. And there will also be that duplication discussion because of the taxi subsidy scheme. I don't know where that's at yet, because I know they were looking at transitioning that out, but that's obviously another government, that's not NDIS, so they just need to be kind of careful there. But you could ask for more funding in core and use the core budget.
It's a bit more complicated. Maybe hang on the end, Carmel, and I can explain something. There's sort of a bit of a trick in core flexibility, but can we sort of hold it to the end, just because I really want to talk about this next little NDIS versus mainstream. So this is where a planner will say that's not the NDIS's responsibility. So this is referring to section 34 of the Act, part F, A, B, C, D, E, F. Yep, the 6th criteria. So this is where the planner is saying, oh no, the NDIS doesn't fund that. That's mental health's responsibility. Oh no, that's housing. Right? So there's the document that I want to show you now where you can go, oh, okay, no. So this is a classic one we see. NDIA planner says the NDIS does not fund psychology, or they'll say the NDIS will only fund psychology if you first get a mental health treatment plan from your GP and use those sessions first. Nope, 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 nope. So I'm going to show you why it's a nope. So I'm going to take you now to an operational guideline that is on the NDIS's website, where I'll show you how these sorts of conversations can be had objectively to justify responsibility, okay? So before we get there, I just want to, again, go over, we are not delegates. However, if we can speak the language of the decision makers and reference their language and their decision-making tools, then you're building your capacity to translate the NDIS and self-advocate, which is what I'm going to show you with this next document. And again, like I said, the 3 best friends are section 34 of the Act, the NDIS rules, and this operational guideline that I'm about to show you. So let me take you to that now, because if people need to leave at 8, I want you to be able to do that on time. So here it is. So this is relatively new, this operational guideline, where they talk about responsibility. And I'm just going to go straight to the mental health one, because it's the classic overused sentence of we don't fund psychology. So remember, mental health or a mental health diagnosis is the responsibility of health and the mental health system. However, if someone is able to have evidence to show that their mental health diagnosis is now a psychosocial disability because it's lifelong and permanent, and it has a profound impact on the person's function and day-to-day life, that is when it could be considered psychosocial disability. And that's when it then becomes something that might be the responsibility of the NDIS. So these operational guidelines go through different sections around responsibility, such as what is the mental health system responsible for? Acute mental health supports, hospital settings, outpatient mental health, things like support around diagnosis, clinical treatment, residential services. Okay, so we know, don't then ask the NDIS for this stuff, because it's clearly saying there's an agreement, you know, across the Council of Australian Governments, there's an agreement that these things are the responsibility of the mental health sector. So therefore we can save time. Let's not ask the NDIS for it, because they can see already it's not their responsibility. Then it goes through, so what are we responsible for then when we're looking at the NDIS? We're responsible for supports that focus on your functional ability. So really, again, that language around function. If you have a mental illness or psychosocial disability, we're responsible for supports that help you with your activities of daily living, taking part in your community, your social life, your study and work. Can you hear the echoes to the legislation language around social and economic participation, and regaining and building skills and confidence in activities of daily living? Again, that capacity building language. So then you go, okay, I'm still not clear. So then you click on examples of supports we might fund. So when the planner says to you, no, the NDIS doesn't fund psychology, you go, oh, that's interesting, because in your operational guideline, you've said that we may fund support from allied health professionals, such as psychologists. Okay, so it's on their own website. However, it's the reasoning behind why we need the psychology. So there is a case study that a friend of mine shares of someone that he worked with who tackled this issue. And the young man had a primary disability of a psychosocial disability that came from a diagnosis of obsessive compulsive disorder. And this man, some mornings, would spend up to 6 hours in the shower. So he was isolated in his bathroom, not able to leave the bathroom some days for 6 hours. So if that man said, I would like psychology because I really want to understand OCD and I want to understand my symptoms and my treatment, then that would be the responsibility of the mental health sector. That would be something that appropriately could be referred through the GP for a mental health treatment plan, because that's around symptoms, it's around diagnosis. But if he then said, pardon?
And treatment.
And treatment. But if he then said, I would like support around the profound impact that my psychosocial disability is having on my life and function, that I'm now socially isolated, I'm not able to access the community, I'm now missing my transport and missing my employment, and I can't attend social responsibilities or my job, I'd like support around managing the functional impact of that on my life. That then is when it becomes the NDIS's responsibility. And actually, in this case study, this man could have psychology from 2 different funding streams because it's 2 different reasons. So if the planner says to you outright, we don't fund psychology, be prepared to reference something like this operational guidelines and be prepared to justify the reasoning around it based on the functional impact, which is NDIS. So again, you can use these guidelines to justify responsibility because it's the language from the NDIS website. This is an NDIS website. So if you have someone who makes a blanket statement to you about we don't do that, use this back at them. And again, it goes through, many people have used this around higher education. So an example we can look at here is around TAFE. Where it will say, what is the higher education system responsible for? So it's things like in classroom teaching and learning assistance. So we wouldn't ask then for the NDIS to fund that because we can see that's actually a responsibility of the higher education institution. However, if someone's attending TAFE and they require personal care and support and mealtime assistance while on campus, that is the NDIS responsibility. So it's here written for us clearly. So they'll actually give some examples of what we'll support. And this is a really helpful tool to look at different mainstream or other government buckets of money when we're looking at responsibility. Now I'm just noticing a lot of chat action. How's it going in the chat? Let's have a look.
Like Rando's comment.
What's he said? What's Rando got for us?
I must say the information has been very helpful tonight. I'm going to feel like Carl Picklington in my responses to them.
Yes. So what we want, Rando, is we want you to shock your assessors. We want them to go, oh, how do you know about this? And you're like, well, I know the 3 different best friends I need to have. And you hopefully will be the smartest person in the room from now on, and feel empowered to speak up. So Ruth, you've got a question in here around the new planning processes. That was a couple of months ago. We did a whole Zoom on that around reassessments and variations and the check-in process. So I would recommend you go back to that and look at
it's recorded.
It's recorded, and it took us an hour to go through that, so we won't be able to jump through that tonight. And we're just having a look. Okay, I think we're almost up to date. Cool. And previous recordings are on Fighting Chance's website, and I will link to that unless I'm looking at Ali. Am I feeling that you're currently searching for that? Yeah, I can see it. She's doing it.
I can pop the link in the chat, but we'll also send round the link to this recording on the website after the session to everyone who's registered and attended. And that you'll be able to see the previous ones and the link there as well.
Thank you, Ali. And oh no, too early for questions. I wanted to just show you guys some resources. So remember, you are the boss of your NDIS plan, but you can only feel empowered if you understand this stuff. So some ways to stay up to date. The NDIS does have a newsletter, so I would subscribe. There's no harm there. They'll tell you when things change. Fighting Chance is trying to get some more resources up on the section of the website that Ali's about to link in the chat. And shameless plug, I also work at DSC, where Disability Services Consulting has a newsletter that comes out often more than once per week, where again, it's around translating NDIS stuff to make sense of things. So go back to the recordings if you want to understand more around check-ins and variations and plan reassessments. We also had a Zoom that went over the legislation changes and what that means for you guys. One of the things that happened in the legislation changes on July 1 is if something has been requested to be funded and it's been rejected, the planner now needs to explain to you why, and they need to clearly show which reasonable and necessary criteria did you not meet. So it's like a bit of a gift on a platter, because then it's telling you, here, go prove this. It's sort of telling you where your gap was. Julia, are you back yet? You had your hand up and you weren't there before. Are you there, Julia?
One other way to, well, I guess not necessarily to stay up to date, but to stay informed is through the NDIS Know-How podcast.
Yeah, through Higher Up, and we're going to be guests on that. So actually, Alex will have some episodes coming out on Higher Up's podcast called NDIS Know-How, and it's all about detailing the language required in reports and supporting evidence. It's all. So it's going to be
a two-part episode, but there will be each episode's quite short, just 10-15 minutes, but it will be talking all about this again, and it will be linking it to reports, clinical reports mainly, and how to ensure that the language is threaded in there, so it's, you know, spoon feeding the NDIA with what they need to make the funding decisions for your people or for yourself.
So we've gone over time. So if anyone needs to leave, we won't be offended. But if you want to stay, I'm going to share with you the participant service guarantee, because Diane has asked a question around what are your options if the NDIS does not meet its own promises. The participant service guarantee is it's a bit of a tricky one for the NDIS, because they have a table that tells you what we want to do and what we promise we're going to do, and then they actually give you the percentages of how often they're actually meeting those promises, and some of them are pretty bad. So you can actually see on here when they are succeeding with their guarantee or not. So for example, they're saying that when we say we're going to do a review that we've agreed to, it's only going to take us a maximum of 28 days. That's the guarantee. But then as of June this year, they're only meeting that guarantee 60% of the time. You can see that there. So I guess in answer to your question, Diane, they're already admitting we're not doing it as good as we say we want to be doing it. Some of these are getting a lot better. But again, the service guarantee can give you some stats. So if you, for example, have submitted a request for a plan to be reassessed or an internal review of a plan, if I were you, I'd make a note of the date you requested that, because then they're saying to you that it's only going to take them 21 days to respond and decide. So count the days. And if they go over, you could then quote the participant service guarantee in your complaint to the agency. Rando saying, how the heck is that acceptable?
It's
I know,
not.
right? But turn your anger around and be empowered by information and reference a participant service guarantee. And it'll be super cool to see how shocked they are when you all start using their language at them. It's going to be great. So I'm going to stop sharing that there and acknowledge that absolutely we are over time. And I did say that I would show something to Carmel about transport, which is, it's not related to tonight's topic at all. So please feel free to leave and go have your cup of tea if you want. But before that, are there any final questions about tonight's content / comments / anything? Either in the chat or come off mute.
I just wanted to acknowledge, I think there was a couple of comments in the chat about providing examples or templates. So we'll, alongside the recording, which we'll send round after this session, we'll be providing some of the links to documents as well. So we can follow up with some of those questions in terms of templates in that email to you all.
And if there's anything specific, the email for support coordination at Fighting Chance is in the chat as well. So you can email your question there and I will endeavour to answer it. Yeah, so that's another option, but there are more and more resources on the Fighting Chance website, which is great.
And we've made it into Rando's gratitude journal for the day, which basically makes my year. So
yeah, that's very
brilliant.
Yeah, that's
Thank you, Rando.
Thank you.
So if anyone wants to stick around and talk about transport, that's cool. You can. I can only stay for another few minutes because sadly I need to keep working tonight. So I am gonna. Are you still there, Carmel?
I am here. Sorry.
All right.
Thank you. I don't want to take up your time. It just is one of those bugbears of mine that I can
have
see
an
the logic.
image, but I have a picture I want to share to you that will explain what I'm trying to explain. So just play some background elevator music while I search for things on my desktop. Really funny, you legend. Okay, so let me just find it. So this is relating to core funding and flexibility of funding. So I feel like I can find it there. Okay, so I just have to find a slide because this is in a slide deck of 300. So just give me a moment. It's not even opening yet. It's not coping. All right, we'll get there. We'll get there. Okay, so I am letting you know that I'm stealing this from my other job because it's a very helpful image. Okay. Right. Apologies for all of this. I'm going to show. Okay, so we mentioned core support. So Carmel had a question around the transport, general transport funding. So when we're looking at support categories in the core bucket, there are 4 support categories. Transport is one of them. So that's your general transport that has the 3 levels, level 1, level 2,
and it's not flexible.
Well, depends. So these are the 4 categories and flexibility rules depends on something. So I'm just going to now go to the slide around that. Okay, so this is what we mean when we're talking about transport in that bucket of money. And so this is the one that highly likely, if you're receiving this, you're receiving it as a fortnightly payment into a bank account, okay? If you are receiving it as a fortnightly payment into your bank account, what happens is a periodic payment every 2 weeks goes into your bank account, and that actually impacts the flexibility of your core budget. So there are 4 support categories in the core bucket, okay? Assistance of daily life, consumables, assistance with social, economic and community participation, and general transport. If you have decided to have it paid into your bank account / it often happens by default and you don't even talk about it, it just happens that way. What happens is you then have flexibility across the remaining 3 support categories in your core bucket. And you'll know if you're getting it paid into your bank account fortnightly because it will look like sort of something like this in your plan. However, you do actually have the right to ask for your general transport to not go into your bank account. you actually have the right to have it paid into your plan. And if you do,
Then
You
it's flexible.
you have full core flexibility across all 4 support categories, which means, like Alex was saying, if you get evidence to bump up the core, say around assistance to daily life or assistance with social, economic, community participation, then you could actually share some of that flexibly into
transport.
general transport. The thing where I get grey though is then how do you then pay for those taxis? So this is where I feel a bit grey, Alex, around actually making the payment for the Uber or the taxi.
Yeah, so
it's different.
so if it's an Uber and even if it's a taxi, it's generally a reimbursement option. So you pay and then you submit the receipt and get reimbursed for it. If it is if you're plan managed and if you're self-managed, then that is sort of how it would need to happen is you would need to pay first. It would only be if you had the periodic payment that you could pay up, like pay with the funding that you had coming in.
Because it's out of your bank account.
Yeah. But otherwise it would be a paying and then get reimbursed.
So if that might be something that might help, that is, if you want to consider editing that would be considered a plan variation, just a tiny little plan, tiny little change to your current plan. You're not getting a new plan. You're not reassessing everything. You're just trying to vary one thing. That's why people are happy about this concept of a plan variation, because you can talk about just a bit. You're basically saying, don't touch my therapy funding, thanks very much. I just want to talk about my general transport. And that's why people are happy about this being this new thing of a variation as of July 1.
Thank you. I absolutely love that. That was just so beautiful to watch, the flexibility there that you showed, but also the way you've tapped into the previous talk about the NDIS, about just because we feel so fortunate with the plan that Jacob has. How amazing that we live in this country where Jacob gets that financial support and we only want to tweak one little bit.
Yeah, and like before July 1, you couldn't tweak a little bit. You'd have to ask the whole thing to be touched. So that is a good thing that's happened. And when I said join the NDIS newsletter or the DSC newsletter, anytime there's a big legislative thing like that, it'll be announced in those kinds of places. So stay informed, because that's when you're going to feel more empowered.
Right.
Yeah.
Sorry, Lisa and Alex, I just cannot thank you enough for the time that you've invested in this and the ease of which you've communicated it to us all. I really do appreciate your time and dedication to helping us all. Thank you.
Our pleasure. And
say hi to Jakey.
Yes, the claps. Look at that. Yes, say hi to Jacob from Lisa and
from us. Yeah.
Amazia, I will do. He's sitting here listening, making sure you're getting it all right.
Oh.
Who Jacob is?
Yes.
Oh, cool. Hi, Jacob. I haven't seen him.
Hey, Jakey.
I'll be at Jigsaw tomorrow if he's going to be there. Whoopsie. That's my
wonderful.
mom.
Thank you. Good night. Thank you.
Bye. Good night.
Bye.
Bye-bye.
Good night, everyone. Rando, I still work in the sector, talking my ear off everyone wherever I can. So don't worry, you can still find me. And also go back and watch the recordings. And next month is Alex talking about how do I know what I'm allowed to spend my funding on? So come back in November. Bye all. I'll end the meeting now. Bye.